In traditional China, when people felt unwell, they would go to a local pharmacy. That pharmacy wasn't just a place to buy medicine, it was also a place for doctors to diagnose your illness. There are 4 steps to diagnose your illness. They are 望闻, 问切. So the first step is 望, which means looking. The doctor would observe your general appearance, like especially the color of your skin, the color of your face, and also they would ask the patients to stick out their tongues to check the coating and the color of the tongues, which were believed to show what's going inside your body. The second step is 闻, which means listening and smelling. The doctor would listen to the patient's voice. They would talk to patients and check whether their voice is strong or weak or a bit rough. And the doctor would also smell any odors from the patients or the odor of their breath, which also give clues to doctors. The third step is 问, which means asking. The doctor would ask their patients about their conditions or what symptoms they have had or what they have been eating, how is their sleeping, or any special things happened or stressful things happened recently. So all these things can combine to affect their health conditions. The fourth step, and also the last step, is 切, which means pulse taking. The doctor would put his fingers on the patient's wrist and to feel their rhythm, speed, strength of the pulse, which are very important and also is the most important steps in these 4 steps. And the very experienced doctors can have a very clear conclusion about the illness by pulse taking. So after he's diagnosed, the doctor would write a prescription on a piece of paper. So generally, the prescription would include 10 or even up to 20 different kinds of herbs. Those herbs include like dried flowers, dried roots, dried seeds, or some ingredients from the animal parts, or anything that you might never expect. And after that, here comes the doctor's assistant. And the assistant would use a very traditional scale, a very little scale to weigh the herbs. And those herbs are kept in a very big wooden cabinet. And in the cabinet, there are lots of small drawers, and in each drawer kept a different kind of herbs. So the assistant would use a little scale to weigh the herbs, and then based on the prescription, after he weighing out all these herbs, he would wrap up the herbs with a piece of paper, and the patients would take the paper packet back home and boil them into the medicine soup. Of course, it didn't taste good. I think most of the time it tastes bitter, and some people believe it really works.